it comes to palliative care, it's really sensitive issue about we need to put in our consideration the all the cultures and the culture sensitivity when we deliver care for the patients. The specific issues in regard palliative care, which is toward the end of life care. I mean, Muslim, they have specific consideration when we deal with them toward the impending death or toward the end of their lives. So we need to consider the culture and what is the patient's and the family's expectations and at the hospital settings and also at the community. And especially for us, like in my hospital, we have lots of nurses from everywhere almost. It's like 29% from US, Canada, and the rest is from Australia, New Zealand, UK, Saudi Arabia. So the minority is from Saudi Arabia or from Middle East, let's say, but the majority, they are Westerns, and we need to train them how to deal with the family and how to deal with the patients and regard the cultures and the spirituality. We actually train them how to know more about the culture, what is the family's expectation, you know, toward the end. It's like how to clean the patient, how to do the shrouding, and also it's very important to know how to talk and the disclosure about the death itself. I mean, it's different from the Arabic or the Western culture and the Arabic cultures. Mainly the families of the patients in Saudi Arabia or at the Middle East who's going to disclose this topic with the nurses or the doctors. So we teach them how to communicate. So we give teaching about the communication in regard the culture. We teach them how to apply some issues in regard the spirituality, call the sheikh or to call the spiritual advisor. And when those patients or the family needed this help, it's like stuff, I mean, something like that. I guess not only in Middle East, it's like everywhere we have a barrier of using the opioid or the morphine. I mean, if you look at many studies that morphine usage is not the same as Australia or at the Europe countries. It's very much low percentage of using the morphine and the opioids. And also I would add, it's from the Middle East cultures, the family and the patient sometimes, it's also a cultural issue of using the morphine for them. Some of patients themselves, they refuse to take the morphine or the opioids, thinking of because it's haram to take morphine. And for me and the other doctors, especially in Saudi Arabia or some countries in the Middle East, we provide the family and the patient with something called fatwa, which is it's like an official statement done by the higher scholars, people that telling the patients it's okay to use morphine and it's not haram. And whenever you need it because you're ill, you can take it. And I mean, we're doing now very much education to the doctors, to the nurses, and also to the family about the morphines, and in particular, and about all the opioids and how to use it. Sometimes it's not only the patient, let's say, it's the doctors or the nurses' fear of giving the morphine or administer it. So that's why still we need more education all the time in regard those patients. Yeah.